What are the labs that we should get done to monitor our health and make sure that we're staying healthy and not developing some sort of disease? So, the labs that you get done at your doctor are not usually as in depth as I like. I like to run lots of markers like inflammatory markers, hormones, deep dives in the thyroid, run autoimmune panels. If people feel like they have chronic things going on, we like to deep dive in those rabbit holes like inflammation, like why, trying to get to the bottom of some of this stuff. So, that's probably not what your medical doctor is doing. You probably have a limited visit, like maybe 15 or 20 minutes, and they're going to go through the basics to make sure that you're kind of just okay. Okay, so let me just run through those really quick and then you can understand like what you have and maybe what you need. So you're going to be getting a comprehensive metabolic panel. Now, that's standard for everybody. That looks at a lot of basic things to make sure that you're doing okay. Now, this is going to be your kidney panel. It's going to look at your liver. It's going to say what your fasting blood sugar is. It's going to take a look at your electrolytes. So all these things are really important as a comprehensive metabolic to kind of say, is this person on the edge? Are they steady? Are they stable? How are the basics? So comprehensive metabolic, yes, you're going to have that done. Now, CBC is the next one that's going to get done. That's going to tell you a lot about like the white cell level. If your white cells are too low, you could have a chronic infection or maybe some autoimmunity. If your white cells get too high, that means you're dealing with more of an active infection. Okay, so then you're going to be looking at anemia numbers. So that's going to say, do you have enough iron and do you have enough B12 to make sure that you don't have anemias, right? So those are your hemoglobin, your hematocrit numbers, all those little numbers there are going to tell you all about anemias. So those are important to know. Now, it's also going to go into things that are going to be like platelets, if you can clot well, right? So that's important to know. And it's going to be going through just all these little basics that are telling us, are you bleeding? Like these are extreme things that we need to know, but also it's not going to tell you much about your optimum health. It's going to tell you, are you steady? Are you stable? Because they'll run those in the ER. They'll run them at an urgent care. They'll run them for your standard panels. They'll also run a lipid panel. Now that'll be your total cholesterol, your HDL, which is your good cholesterol. We want to have that above 55. They're going to look at your triglycerides and say, if those are above 150, then you've got some metabolic syndrome happening and you've got some maybe pre-diabetes brewing. And those gives us some clues as to how you're handling like your blood sugar and your storage of blood sugar that gets stored in triglycerides. Now your LDL, that's the bad cholesterol that you could make a lot of this. You know, your liver makes 75% of that, and your diet really is responsible for about 25% of that. So we want to look at that LDL. It's not going to give you the breakdown of the LDL and the different particle sizes, but it is going to give you an overall number. So that's pretty much what they're going to run. They might run a vitamin D on you. They might run a TSH, which is thyroid stimulating hormone, if you ask for them. Now, that's pretty much what you're going to have run. So most people don't come in with more than that. But let me tell you what I like to run. And actually, I'm going to have in my my YouTube profile, it's going to have like a little link tree app, and you click on that. It just says essential labs for everybody. So you're going to want to you can download that, and then you can bring that to your doctor. If you need some help running some of those labs, you can always let me know. But I'm going to go through some of these and tell you kind of what I really like to run for most patients. So I'm going to run a comprehensive metabolic analysis, just like you've had run. I'm going to run a CBC. Okay, great. Now, then I'm going to run a lipid panel with a lipoprotein little a. Lipoprotein little a tells us a little bit about your genetic predisposition for getting heart disease. So they call that LP little a as well. So that's an important marker to know. Now, another one I'm going to run is an apolipoprotein B. That's going to say, hey, are you developing chronic cholesterol issues? Are you developing atherosclerosis on the daily? Maybe. So we should look at that number. I'm also going to run a hemoglobin A1C. Now that's going to tell me how your blood sugar has been over the last 90 days. So it's going to tell me, sometimes it can look pretty good and you're high and you're low, right? And you're low. Sometimes you can be trending high and you can have prediabetes. Sometimes we catch diabetes. So this one's not as great at looking at hypoglycemia, but it's going to tell us a little average of your blood sugar over the last 90 days. So that's important to know. Now I'm going to also look at a fasting insulin. I like fasting insulin to be 3, 4, 5, 6 in there. If your fasting insulin is 15, it tells me that, man, every morning when you wake up, boom, you got a lot of insulin popping out because you're having too many carbs. So this tells me that you were looking at different things for blood sugar issues. A lot of people have blood sugar issues. So we're going to look at fasting insulin. We're going to look at hemoglobin A1C. I'm also going to look at your triglycerides, because if your triglycerides are over 150, it tells me you probably have some metabolic issues that are kind of pre-diabetic leaning. So that's kind of something it's a whole formula. You have to look at the whole puzzle. We can't just look at one number and decide what you have. We have to look at the whole picture. This is why I run a lot of labs. Also, we're going to look at, some people have histamine issues. I toss that on my list. Not everybody needs to run histamine, so take that with a grain of salt. If you have hives, if you tends to have like this thing called MCAS, that's something that I'm going to run on patients. I'm also going to run a homocysteine. Now, homocysteine is really an interesting marker. It tells me how well you break down protein into amino acids, into homocysteine, and then you take B12 and folate and you break it all the way down into SAMe, and you break it down into glutathione. Now, this is a process that's called methylation. I don't want to get too wordy into this because I don't want you to be like, oh my God, what does that mean? It just means breaking down things, like breaking down homocysteine with B12 and folate. How well do you pull B12 and folate out of food and process your homocysteine to bring it down into a more functional, happy product for us, which is the SAMe and glutathione. Those things are important because if you have too high a homocysteine, it can be a risk factor for getting heart disease. Homocysteine can be very scratchy to the insides of your blood vessels, and that can actually contribute to you putting cholesterol on the walls of your blood vessels and some narrowing of your arteries. So that's important. So we need to know that. This is also methylation. This methylation cycle is also a detox pathway. So if you don't have that working, then one of your liver detox pathways, your methylation pathway, is probably not working. So you don't detoxify things as well. So homocysteine is really important for us to know about. I really like that number. It gives me a lot of information about a lot of other processes that are going on. Let's see. I check B12 and folate just to see how well you're absorbing those things. Those are important for us to know. Are you at the bottom of that? Are you at the top of that? Like, where are you with that? We're going to look at two inflammatory markers. One is high sensitivity CRP, HSCRP. Those are markers that are going to tell me, that's going to say, do you have inflammation? It's very high sensitivity. They tend to use it for like risks of heart disease and such. I like that marker. It tells me like, how's the overall inflammation going in the body? And with that, I usually run an ESR, erythrocyte sedimentation rate. That tells me how fast erythrocytes will drop in fluid and its heaviness, and it's like kind of an inflammatory marker. So that's, sometimes I'll toss that one on there too. We're going to run a big panel on your thyroid. TSH. Now, TSH is, here's your pituitary. Your pituitary signals your thyroid with thyroid stimulating hormone. We look at that number. How loud does your pituitary have to yell to get your thyroid to work? And then your thyroid is going to release T4. And then you're going to get it converted into T3. These are numbers I want to see. How much thyroid hormone's coming out? Are you a good converter? Sometimes people don't convert T4 to T3 really well. So that's a number we want to know. I also want to know thyroid peroxidase, which is TPO. I want to look at thyroglobulin antibodies. Those are going to tell me if you have Hashimoto's. Okay, so I really want to know if you have Hashimoto's. That's important to me. I work with a lot of autoimmune patients, so it's important to know that. I also want to know a rheumatoid factor. If you have joint pain, I want to run a rheumatoid factor and an anti-CCP. Those are both going to be pointing toward rheumatoid arthritis. If I feel like that's indicative of your symptoms, we're going to do that. I also am going to run an ANA, so anti-nuclear antibodies. Now I'm going to run an ANA with a cascade. Now, if you're ANA positive, which means your immune system is attacking some sort of your own tissue, then it's going to be attacking your DNA. That's what ANA means. And then they're going to run what's called a cascade, which is going to tell us what tissues are actually involved. Does this look like it's going through dry eyes and dry mouth like Sjogren's? Is it moving toward lupus? Is it a connective tissue situation? These ANA patterns are really important for us to run if you're ANA positive. So I will run an ANA cascade. It'll give you a number, which tells me a little bit more of an intensity of how much activity you have going toward this, this autoimmunity. It tells me how much on fire you are. Okay, so that's important. I'm always going to run a vitamin D2, D3. We want to know what your vitamin D is. And that one is important, especially if with COVID flying around, with autoimmunity flying around, everybody's got autoimmunity, it seems. The immune system is going to be modulated or calmed down by vitamin D. So that's important. Now, I'm also going to run your iron with your saturation rate, with your ferritin. Those are all going to be important for understanding what's happening with your iron. I want to know if you have enough iron. if your iron is binding in your body, if it's going into storage properly. I see a lot of people who have enough iron, but it's not going to storage. It's not getting onto the hemoglobin. And that's called anemia of chronic inflammation. That's important for us to know. If that's happening, we got to know, because you can have iron and it's not doing what it needs to do and you're tired. Okay. So that's important for us to know. Also, I'm going to run your hormones. I'm going to run estradiol. I'm going to run progesterone. I'm going to run testosterone, total and free. And I'm going to run DHEA. So those are markers we're going to run. Now, if it's men, I'm not going to run progesterone. I'm going to run estrogen though, and I'm going to run testosterone free and total, because men with bellies, big bellies, convert their testosterone into estrogen. So I want to know if they have too much estrogen. I want to know if that's happening. I want to know if I need to get in there and do an estrogen blocker, and I need to maybe help get their inflammation down so they can make more testosterone. Now with women, I'm going to also run testosterone, because you're going to have estrogen that, if women have too much belly fat, they convert their estrogen into testosterone. That creates something called PCOS. Usually have high insulin at the same time. So I'm going to want to know, are they having, if this is testosterone dominant, do they have PCOS? Is this why their cycles aren't regular? Is this why they can't get pregnant? What's happening with their testosterone? So that's important. So there's a lot of other markers I can run, but that's my panel that I run. That's like maybe minus histamine, but those markers are going to tell me everything I need to know and everywhere I need to start. And if I know where to start, then I can go down other little rabbit holes if I want. But this is a great panel to really watch every single year. Now, on an additional like markers, if I have women that are in their 60s, I might run, and even men, I could run this, but I don't run it as often. There's a CEA, there's a CA 125, and there's a CA 19-9. Now, CA 19-9 is a little bit more for pancreatic cancer. CEA is a little bit more toward breast cancer and colon cancer. It's got a little liver in there, but I'm just looking at those markers. If they got high, I would do a little bit more investigation. CA 125 is a little bit more around ovarian cancer. So if they tend to run that marker, if you've already had ovarian cancer, sometimes I'll toss it out just to kind of get a little read to make sure things are going okay, especially if there's a lot of abdominal bloating. We'll take a look at that. So those are the markers I run. If you need some help running some blood work, if you have a doctor that doesn't run blood work for you, there's a company called Rupa that I work with, and I can always help send you a link to get blood work done. If you have regular PPO health insurance and insurance covers your labs, it's easy to kind of send you a link through Quest to get some blood work done. So if you need some help, you can always reach out. If you have labs that you want me to take a look at, I'm happy to take a look at them and tell you what else you need. The magic is in these labs. If you want to know how your health is going, look at your labs. You can feel good and your labs can look a little off. You can feel crappy and your labs can kind of look just a little bit like mediocre, where you're like, what the heck's going on? So we do deeper dives. So it depends on your symptoms. We might do deeper labs, but there's magic in these labs. And it's not hard to really decipher. If you need some help, reach out. If you need some guidance, I do online functional medicine sessions that I can take a look at your labs and tell you what you have and what's going on and give you some suggestions. So if you want some help, reach out. Look forward to talking to you.